Hi, thank you so much for participating in the ACP Wellness Wave brought to you by ACP Southern California Region 3 chapter. My name is Alex Malouf, and today I am so honored to interview Dean Guluma. Hi, Dean Guluma. How are you doing today?
Good. Hi, Alex. Thank you. I really want to thank you for the privilege to talk to you today.
No, we are so grateful to have you here with us today to share your knowledge with us, and was wondering if we can start off this conversation with you telling us a little bit about yourself and what you do.
Yeah, so my name is Guluma. I'm the Associate Dean for Admissions and Student Affairs at the UC San Diego School of Medicine. So what I do on that end of things is I oversee the admissions process and the selection of med students. And we hold that as a very privileged role, a very important role, because we're giving young people the opportunities to become doctors, at least through our school. And then I also do student affairs. It's a combined job. So I always tell students that I oversee the process in which people get selected for med school, and I take care of students all the way through until they graduate and walk across the stage. My other job at the UC San Diego School of Medicine is a faculty member in emergency medicine. So I work in the emergency department. I take care of patients and teach medical students and residents about emergency medicine.
What a rewarding job you have, really seeing it through your medical students from the beginning to the end, and also quite varied, right, with emergency medicine. And I just wanted to ask you, Dean Guluma, how did you choose your career path in medicine?
I think it starts off with, for example, why did I choose to do emergency medicine? And that it's like many things in medicine, it's sort of happenstance. I rotated in the emergency department when I was a med student as an elective, fell in love with it. And it just, for me, practicing medicine, it's something I like to do. And it's a way of approach that I really enjoy with patients. Emergency medicine involves problem solving. For example, if someone comes in with chest pain, you never quite know what that chest pain is due to, or if it's even really chest pain. And I love that in detective work of figuring out what's going on with patients. I like helping patients in acute pain, because oftentimes people show up in the emergency department with acute pain or some acute problem, and you get to alleviate pain very dramatically and immediately. And of course, life-saving measures as well, procedures. I love the camaraderie that comes from working with a team of both like-minded individuals and nurses, techs, just the whole package. But as you can see, my career path took me into, at some point, into research in medical education. Now, how did I discover that? Well, it's just, I remember once sitting down with a colleague when I was a young professor, and I told her, God, the two things I love in medicine, apart from medicine itself, are research and teaching. I love to see young physicians to grow and develop into the people that they have potentially. I love to help them with that. And of course, I like research. So it's no surprise that my career is taking me through research and also medical education.
That is really nice to hear that, you found your niche by enjoying being a detective in emergency medicine, and then knowing early on that, research and teaching was important for you, and you found exactly that role now. So thank you for sharing. But some of us, though, we're still trying to figure it out, really, both medical students and residents. Do you have any advice for us as we're trying to figure it out?
This weighs into the burnout question, right? Why do people burn out, or what makes people show up to their jobs? And it's all about meaning. I remember I talked to a med student whose father was an emergency physician, and I was curious, like, what is it like being the son of an emergency physician? I was just curious what it was like on the other end as a child of a physician. And he told me, my father loves his job. He just loves it, I also remember talking to one of my emergency medicine residents whose father was a cardiothoracic surgeon. And I remember sitting in the ED one day and asked, what was it like being the daughter of a cardiothoracic surgeon? And she said something very similar. Oh, my father just loves his job. And in each of those people, when I talked to them a little more, it's very clear, and they felt it. And they were both obviously went to med school. One became a resident, one was a med student. They both went to medicine, inspired by their parents. And the recurring thing is their parents found so much meaning in what they did. So one thing's very clear in terms of choosing a pathway is looking for meaning. Now, how do you find meaning? One tip I'd give really is look at what you do outside of medicine, and ask yourself, for example, you have a hobby, you're outside medicine. Why do I enjoy this hobby? And then ask yourself, why do I enjoy this hobby? And I think embedded in that will be this psychodynamic principle. That's what you're going to find an imprint of in your work. So that's one tip I would definitely recommend. So find something that's meaningful to you on a very personal level, and then you'll enjoy that work and be like those parents or those students in that resident that I talked to.
I absolutely love that. And that idea of the psychodynamic approach to what you're passionate about, or whether it be a hobby or an activity, and really seeing that fingerprint. I mean, that is really something else. That's very good advice, Dean Guluma. Now transitioning over to our wellness question. And for you, I think I wanted to ask you about whether you have any kind of wellness approaches that we can implement on a medical school level, residency level, or just maybe some personal approaches that you would like to share.
Yeah, I mean, maybe I'll pull out from the individual level, personal level, and now to an institutional level and a systemic level. As you know, one thing I already mentioned, that finding meaning in your work, that goes a long way. As an individual, and I've definitely sought this, is to find community in my work. So when you're working with people, find a community that you enjoy working with, find meaning in what you're doing, and also be very aware of your own body, your own emotions, your own self, and how you're reacting to it, and be responsive to that. If you shut that off and just keep working and not paying attention to cues and clues, burnout can sneak up very quickly. So, and part of it is self-compassion, finding a balance, finding a hobby outside of medicine, finding meaning within medicine. And those are all things. I mean, of course, wellness, you've interviewed many people on this in this wellness wave, and they all have their individual tips. I'm sure you're noticing themes, or you will notice themes as you go forward. They were all very similar. In terms of applying things from an institutionalist perspective, that's one thing I'm especially excited about, because that's my role here in the School of Medicine. So we are approaching, for example, the next few years, we're really being intentional about our wellness programming, teaching people how to be well, and giving the tools by which to do that. What do I mean by that? Well, it's thinking about, one adjunct is self-compassion. The other thing is mindfulness, being aware of what's going on in the moment. The other thing is peer-to-peer mentorship and coaching, and learning how your own responses to what's around you, the stresses, you can talk to yourself and find out how you're feeling and redirect and put things in context. And I think that kind of holistic approach should go pretty far, at least we hope.
Yes, I think that's great from a personal level, the cues and clues to pick up on yourself. And then on an institution level, like the importance of just integrating these wellness approaches that you mentioned, like the peer mentoring. And so, yeah, that's great. And now one question for you is whether you have a wellness phrase or quote to share with our audience.
I really go forth in my day-to-day things, whether it's a busy ED shift, whether it's an angry person I'm dealing with, or even a colleague that's struggling, and or even a consultant, something I'm working with. I go through everything, even a hard day at work. I hold two phrases, and I would say, if I were to choose a wellness phrase, is hold gratitude and compassion close together. By gratitude, I mean, just ask yourself every day, okay, things didn't go well here, things didn't go well there, but what am I grateful for today? And I assure you, almost every time, every move, there'll be something you're grateful for. And then in terms of holding compassion, so hold gratitude and compassion. Is compassion towards others, meaning compassion to your patients, compassion to your colleagues. No matter what is happening, even if someone seems somewhat adversarial, if you just look a little deeper, you'll find out, with a rare exception, that they're doing it because of something else going on in their lives. And once you put that within a compassion framework, everything sort of makes sense. For example, if you're on a phone call and a colleague is not complying or being difficult or even rude, there's something going on. They didn't start that day planning to be rude to you. It's just you have to understand there may be something going on, and just being compassionate and being aware something may be going on. And whether it's a patient doing that, a supervisor of yours, a colleague, even a family member, holding those two words, gratitude and compassion together, will take you a long way.
Yes, I think that is so true. Gratitude and compassion together will definitely open a lens of how to see people and the world in a very nice way. So Dean Guluma, that wraps up our interview. And I just want to say we are so privileged to have you here with us. You are such a leader, role model. And so thank you for sharing all your advice with us.
No, Alex, I should thank you. I think you are the real leader here in starting this initiative and doing these interviews and sharing people's thoughts with the world at large. So thank you.
Thank you so much.